Let's talk healthcare and the economy of getting sick. You know, we have the highest advanced medicine and treatment in the world right here in Los Angeles. But the sad truth is that most people can't get to it. Doling out healthcare in LA isn't democratic. According to Time magazine, more people are sicker today than ever before, and the next generation will be worse. So how do we create a healthcare system that takes care of everyone in this city? First, an expert's view on the status quo, for-profit healthcare in Los Angeles.
The opportunity and the possibility of living a healthy life, I think, is a basic human right. Healthcare is something that society has to decide how it's going to provide it and how we're going to pay for it. It's difficult to really separate for-profit healthcare from not-for-profit healthcare in Los Angeles because the two work hand in hand. We succeed in that we have extremely high quality of care in a lot of areas. I mean, we have technologies that aren't available in other countries, even in other parts of the United States. So when it comes to technology, we're second to none anywhere in the world. When it comes to quality of care, the actual delivery and the outcomes we're getting, we're not achieving the numbers we need to achieve. Well, the failure of healthcare in Los Angeles right now is that we're not providing an adequate safety net for those people that don't have health insurance. And I think that's probably the most drastic thing that we have to deal with and deal with quickly. We have segments of our population in Los Angeles that are in crisis. For example, the Hispanic community in Los Angeles has the highest percentage of uninsured of any group.
What do you say to those who want to remove profit altogether from healthcare? It's difficult, you know, as a funding mechanism, and that's really what health insurance is. Health insurance is the way that we fund healthcare in this country. The profit that health insurance companies work on is anywhere from about 0.5% to 3%. So it's not a big part of our healthcare budget, but you have to look at what you get for that, whether it's chronic disease management programs or the equipment that we were talking about. There's a lot that comes from a for-profit company that people forget, and that's the capital investment that those companies make in our hospitals, in the technology, and in the care that people get. What do? We as a society have to re-examine what we feel about healthcare. Is basic healthcare something that we as a society think that we should provide on a general scale for everybody, for every citizen? And it comes into question, what about the non-citizens? They're here, they're working too. These people have a right to have a healthy life too.
For sure. What about those newly arrived immigrants, the poor and the elderly who aren't covered under an HMO or a PPO or some kind of employee union plan? Here to talk about this is Jim Mangia. He is CEO of St. John's Well Child and Family Center Clinics. He runs 11 of these clinics here in Los Angeles. All are nonprofit and open to anyone seeking not only a cure, but some compassion and hope. When it comes to caring for the ill, some call Jim Mangia the Mother Teresa of Los Angeles. Do you like that title, Jim?
It's a first.
Yeah, it's a first. But you know, what they're really talking about is the spirit of Mother Teresa, which you seem to embrace by taking on this enormous task of trying to address the sickness problems of an area of Los Angeles, which is what, poverty pockets of LA, and bring these people some sense of hope and this right, this unalienable right to be well.
Well, I think that's the fundamental mission with which St. John's and I operate, which is essentially that healthcare is a right, it's a human right, and we need to work as such. It's really unconscionable to me that there are 1 million residents in South Los Angeles, a majority of whom are uninsured. How is it that 48% of the kids who live in South LA are uninsured? Some of us have to do something about it, and in some ways that's the vision and the mission of St. John's Well Child and Family Centers.
Let's talk about the broader issue, Jim, and that is healthcare, nonprofit, for-profit. It's been said by many experts that for-profit and nonprofit really can't be separated because in the scheme of things they operate together. Can they be separated, or realistically, are we talking about both kinds of health care when we talk about solutions?
Well, I think in the current system, in the current organization of healthcare, I don't know how they could be separated. I think you would have to really revamp the whole system from the bottom up and the top down in order to separate those out. So I do agree that there's an inextricable link between nonprofit and for-profit healthcare. I think the difficulty is, there is some difficulty in that interrelationship, because we provide care to anyone who presents regardless of their ability to pay, but the the pharmaceutical companies and the medical supply companies don't take that into account when they charge us for the pharmaceuticals and the medical supplies that we purchase. So it is a difficult game and a difficult dance. But, you know, the fact is that a significant percentage of our healthcare dollars go to nonprofit healthcare. And as we know, there are vast numbers of people without health insurance, and who cares for those people are the nonprofit community clinics and hospitals on the ground.
Like you. And we're going to get to that in a minute, but I want to ask you one more question about for-profit. The argument is that if we don't have for-profit, we're not going to get the kind of advancements that we're seeing in technology. There isn't going to be the latest MRI machine available to spot colon cancer or something of that nature. So nonprofit realistically probably isn't going to completely disappear if the United States suddenly becomes a social medicine country and gives everybody the kind of health care they need.
Well,
I mean, there's going to be people who are going to say, I don't want part of that. I want the for-profit stuff because I want to choose my doctor.
Yeah, I mean, I think, you know, we do live in the United States of America, which is the center of capitalism in the world, and you know, I think you're going to have a mixed system, which is what Obama's been talking about, and I think that's the next step. However, what you have to look at is that the overwhelming percentage of healthcare dollars is spent on the back end. It's spent on these expensive testing, expensive keeping people alive, and what's ignored is prevention and public health. Mm-hmm. So there's a lack of investment in public health up front and prevention, which would prevent people from having to use those machines that cost so much money to keep people alive.
Not to mention the enormous amount of money that goes to management and these CEOs and their perks.
And their golden parachutes,
yeah,
and, you know, their profit incentives and so on, yes. But again, this is the system in which we live, and some of us are building a nonprofit aspect of the system, and some of us are building a for-profit, and we have to work together. But again, the fundamental issue for healthcare is, are we going to invest in prevention? Are we going to make the American people healthier? We spend more money on healthcare per capita than any other nation in the world, and we have the worst health outcomes of any industrialized nation. Why is that? Because we're not investing in prevention.
All right. You try to deal with prevention at your clinics, but most of your work is just taking care of someone who walks in with a malady of one sort or another. Explain how your clinics work. For instance, how do you pay for it?
Well, it's kind of a mixed, it's kind of a, you know, taking from Peter to pay Paul, and, you know, there's a kind of
who are these Peters and who are these Pauls that are giving you money?
Well, there's many different programs, and, you know, if there's ever an argument for a single payer system, it's the community clinic world, because we have to bill a number of different programs, all of which have their separate forms and their separate bureaucracies and their separate policies and procedures you have to follow. So there's county programs, there's state programs, there's federal programs, there's Medi-Cal, there's Medicare, all of those different payer sources. And you know, a patient walks through the door and you say, okay, what can we bill? Can we bill for this patient, and which payer source can we bill? The other issue is that there's a lot of charity dollars that come in. So foundations and individual donors provide a lot of support for community clinics and for St. John's, which help us make up that fundamental deficit, that functional deficit in providing services to the uninsured.
Which is your busiest clinic?
They're all busy. I would say that right now our busiest clinic is probably in Compton.
And how many people is the clinic seeing on a daily basis?
Between 150 and 200 patients a day.
Do you ever turn any away?
We don't.
You deal with the problem.
Exactly.
They don't have any money, and you're really their last resort, right?
Exactly. Exactly.
Dealing with them is a unique situation because For instance, if part of the treatment is go home and eat more vegetables, the family can't do that, can they? Tell us stories about that.
Well, you know, particularly with the economic crisis, we're seeing a lot of patients who are hungry, an increasing number of patients without food. And so we're now looking into developing food banks and food cupboards at our clinics so that we can provide food to the families. But a lot of, I mean, we're really a comprehensive community clinic that provides a holistic view of health care.
Right.
So, for example, if a patient comes in with diabetes, we know that we need to bring their hemoglobin A1C levels down, but if all they have to eat is tortillas and coffee, we're not going to be able to bring the hemoglobin levels down. So what we have to do is we have to develop a whole host of programs, and we do this. So for example, for a diabetic patient, there's exercise and fitness classes. There are cooking classes to teach families how to cook with healthy ingredients. We actually go out, we have community health promoters who go out to the local liquor stores, which is where most people in South LA shop. Mm-hmm. There are no supermarkets.
Right.
To start to purchase fruits and vegetables and put the healthier foods in the front of the liquor stores. So we're doing a lot of work. It's extremely comprehensive. But how do you address the fundamental social determinants of health and poverty which our families live, which cause them to be sick?
What happened to you when Martin Luther King closed down?
It was really a nightmare. We're a primary care and preventive care clinic. So we had patients presenting with gunshot wounds and heart attacks, and patients that had strokes driving themselves to the clinic. And we developed urgent care centers at all of our clinics surrounding the hospital so that we could at least provide some semblance of emergent and urgent care. But we're not a hospital. We don't have access to a lot of the things that emergency rooms have. And so what we would do is stabilize the patient and then refer them, in the case of Compton, to St. Francis Medical Center or one of the other California Hospital Medical Center, one of the other clinics around there. And, but basically we had the job of stabilizing that patient who was bleeding out at a primary care clinic.
And your doctors and nursing staff are trained to do this?
Well, those who weren't became trained, and you know, obviously we're not an emergency room, but we were providing a lot of urgent care, so we expanded our urgent care services, and luckily some of the money that had been going to Martin Luther King as a result of now supervisor, then State Senator Mark Ridley Thomas and State Senator Sheila Kuehl, some of that money was funned into hospitals and community clinics who were taking up the slack from the hospital.
I hope I'm not being premature with this, but isn't there talk about UCLA or another entity coming in and taking over where Martin Luther King left off?
Yeah, there's a lot of conversation. Supervisor Mark Ridley Thomas had a press conference this morning, actually, to talk about a public-private partnership to operate Martin Luther King Hospital. I think if anyone can do it, he can do it. Up until this point, the Board of Supervisors has been unable to reopen that hospital, and frankly, the hospital should have never been closed in the first place, in my opinion. Mm-hmm. And the fact is that what was the management at the Department of Health Services that allowed that hospital to get to the point where their Medicaid contract was pulled by the federal government?
Jim, I know the pressure you're under because I've seen the clinic and I've seen you operate. Why do you do this? What's in your background that you feel you have to be compelled to put this kind of pressure on your shoulders?
I think I care about the world. You know, when I was a kid, my dad used to tell me, you can't take the whole world's problems on your shoulders. You just can't live your life that way, but it is the way that I live my life. And
you didn't listen to him?
I didn't listen.
Why?
I just, somebody's got to do it. And we have to care for the poor. It's really a shame that the richest country in the world has such a high rate of poverty, and somebody has to address and alleviate the effects of poverty on the population. And I believe very, very strongly in social change, and I believe very, very strongly that there should not be poverty. And so that's what I've done with my life's work, is to help eradicate poverty and provide services and care to the most vulnerable people in our society.
Do you think your clinics are a model for mainstream medical care?
I think they are. I think they are because we are so involved and so invested in prevention. And we're so involved and so invested in the holistic approach and a comprehensive approach to health care that includes understanding the social determinants of health. Let me give you an example. 54% of the kids who come into our clinics are lead poisoned. How are they lead? Now, lead poisoning is, lead is a neurotoxin which causes decreased brain function, developmental disabilities, and if left untreated, mental retardation and brain damage. 54% of the children who walk into our doors, we see 100,000 patients a year. 54% of the kids are lead poisoned. How are they lead poisoned? They live in slum housing, leaking pipes, degradation of the lead paint, causing dust in the apartment. Kids are crawling on the floor. They're pulling themselves up by the windowsill. They're putting their fingers in their mouth. They're becoming lead poisoned. So we had to develop a comprehensive approach. So we developed the Healthy Homes, Healthy Kids project, in which we have community health promoters actually go out to the home, train the families on how to clean, how to create barriers to keep the cockroaches out of the ears of the children while they sleep, how to prevent the lead dust from degrading and causing lead poisoning. So we had to deal with all of that in order to bring the blood lead levels down, which now we've done in 95% of the kids.
Well, good for you. You know, you're opening up a whole new area that's a whole new show. So we want you to come back and talk about that. Thanks for being in the world, Jim Mangia.
Thanks for having me.
We
Bob.
need you.
It's great to be here.
You're watching LA Business Today.